I'm Dr. Ang Ghee Aik. I'm the resident consultant orthodontist at Adventist Hospital, the Dental Centre, for many years now. Conventional braces have been proven to be very effective and reliable, and of course also affordable in terms of cost. Conventional braces, as I said, is the standard type, and they have both metal stainless steel and clear ceramic brackets. They are not just metal braces. Perhaps I can show the difference between the two types of braces. So what we have here are the parts of what we call the brackets that they attach to the surface of the teeth and carry the orthodontic wires. These are components or parts of the braces. So the brackets can be metal, stainless steel, or ceramic, in this case, clear and transparent. It is up to the patients to choose which type they want during treatment with conventional braces. The clear ceramic brackets are a little bit more expensive, of course. Treatment is about the same, time is the same, methods are the same. It's just a difference in material. And of course, these are more aesthetics in that sense. The clear, transparent ones. Conventional braces differ from other forms of fixed braces in the way we tie these orthodontic wires into the brackets. In conventional braces, we tie them with elastics. Whereas in the other types of fixed braces, they tie with a self-locking pin. That is the difference. The elastics that we use in conventional braces can be colorful or they can be clear and transparent. It is up to the patient to choose which type they want. And of course, during the course of treatment, we change wires and we change the elastics. Some of our younger patients actually have great fun choosing colorful elastics. To them, they like to compare with their friends who gets what color. Even our older patients, our adult patients, do sometimes opt for the colorful wire elastics. Here we have a model of a set of braces in which the colorful elastics are on the upper side and the clear or gray elastics are on the lower, whereby they are less visible. The colorful ones are of course very prominent. Again, the patient chooses which type they want. Every time we change the wires and we change the elastics. The great improvement in orthodontic treatment recently has been the use of newer alloy wires that we did not have in the older days. These wires are a great improvement in the sense that they are very light and flexible and resilient. So in that sense, they move the teeth. It is the orthodontic wires that move the teeth. So they move the teeth more gently and more continuously with less force. Continuously because these wires are also non-distortable. That means you cannot bend them. They are made in an ideal form, and when they tie into these crooked teeth, they are all the time continually moving these crooked teeth into position with very light, gentle forces. And that is a great improvement. That's why there is much less pain and discomfort associated with orthodontic treatment. And because they continuously move the teeth, now we have treatment that is much faster, teeth move faster, and the treatment time is much less. So those are the benefits that really are due to the improvement in the orthodontic wires. The wires we mainly use now are the nickel titanium wires. And you know, titanium is a fairly expensive thing. So these wires are very flexible. Let me show you the wires that we use now. This is the nickel titanium wire that we initially used to move teeth. The old wires that we use, hard stainless steel wires. You see how flexible, you can see this. You see how flexible it is and how light the wires are. This is very stiff, hard. Now besides that, these wires are formed into an ideal shape. So they are continuously moving the teeth into position in this ideal form. So it is a continuously moving teeth. So the treatment is much faster, and because they are so light, they are much more comfortable. Less pain. The older wires are more stiff, and besides that, as I said, they are non-distortable. So again, if I try to bend this wire, as we tie it into various crooked teeth, they always spring back into this nice shape. So that means that's the reason why it's continually able to move the teeth and gives you faster treatment. The other wires, if I bend this wire, it stays bent, cannot recover. And that is a great change in orthodontic treatment, giving us more comfortable treatment, less pain, faster treatment. So as I said again, the wires that we often use now are in the early stages of treatment, are the nickel titanium wires that continuously, gently move the teeth into position. So therefore, nowadays, average treatment time is about 1.5 to 2 years. It can be faster. Some patients finish faster than 1.5 years. Some patients may take longer. Again, this depends on the complexities of the treatment and of course on patient compliance. Orthodontic treatment needs patients to be aware of certain ways of taking care of the brace, sometimes to wear elastics, so we need patient cooperation too. But on general, it is about 1.5 to 2 years now, treatment. Well, usually we would do active orthodontic treatment when most of the adult teeth are erupted, except for the wisdom teeth. The reason being that if you treat halfway through treatment when some of the baby teeth are still changing, then the whole thing is still evolving. The teeth are coming through, new teeth are coming through, so it's quite messy to be starting treatment now. I would prefer to wait until most of the adult teeth have erupted, and then we will start active treatment if they need. This is about 12 to 13 years usually starting from then. But it is a good idea for parents to bring their children in a bit earlier. This is because the orthodontist can then check and see how the teeth are developing, how the adult teeth are coming through, and what measures the parents can take to make sure that the eruption of the teeth is orderly. Keeping the baby teeth, brushing them, things like that. Okay? In also certain cases, very rare cases, the orthodontist can spot cases that need early treatment. That means before your 12 to 13 years even. Because those are instances where, say, for instance, a patient who has a very small mandible, a small lower jaw, and those types of cases sometimes do benefit from a special type of functional brace, which means it's a removable brace designed to try and encourage growth of the lower jaw, not to move the teeth, but to grow the jaws. So those cases we do sometimes treat early. Also, there are certain cases of patients, children with incorrect bite that causes damage to the teeth. Now, those cases, some do really need certain early treatment. We cannot afford to wait until all the adult teeth have come through before we initiate treatment, because by then, the teeth that is being damaged may be lost. Those are cases where we do sometimes do early treatment. So it is a good idea for parents to bring their children in early so we can see, not necessarily to start treatment, but just to have a look and see how the occlusion, the teeth are developing. So we know whether we need early treatment or not. But by and large, we will start treatment when they are about, all the adult teeth have come through, as I said, 12 to 13 years old, by which time also the children are actually more aware of things, more able to follow instructions. If you are earlier, they are more playful. So now at this age is about a nice time to do. They are also growing fast, and growth does help in the movement of teeth. So that is a good thing. Of course, older patients, adults can also be treated successfully. So I have treated a lot of my patients are adults, mature adults. So long as your gums and teeth are sound and healthy, you can have the orthodontic treatment even if you are an adult. Well, we know that most patients come for braces because they have crooked teeth, unsightly teeth. When they smile, they show their teeth uneven. So it probably affects their feeling of self-confidence sometimes, may induce shyness. So it is a good thing, of course, to have straight, even teeth, improves our appearance, improves our self-esteem. So those are the benefits that most patients sought when they come for orthodontic treatment. But there are other benefits that are equally important. And one of them is that a set of straight, even teeth is much easily cared for, and you can brush easily. And that is important. That means you keep your teeth for as long as you can. Crooked, uneven teeth, overlapping teeth are very difficult to brush. There are areas of stagnation where you can never brush it at all. And these areas can give you the decay of the teeth, cavities, or they can give you gum problems, leading to loosening of teeth, maybe even later loss of teeth. So it is important that we have straight, even teeth, not just for appearance, but so that we can brush and keep the teeth cleaner and stronger and for longer periods of time. Remember, teeth are not there just for appearance, they are there for us to eat and chew food. And enjoying good food is one of life's pleasures. And of course also a necessity, because being able to chew and eat properly gives us better nutrition and better health. So the orthodontic treatment, you're giving you a nice set of teeth, it improves your appearance and gives you a good set of teeth that you are proud and motivated to keep clean, easily keep clean too. Okay? Also, sometimes we do orthodontic treatment for other types of dental treatment. Say if your patient needs dentures for missing teeth, or they need a bridge to insert to replace the missing gaps of their teeth, then sometimes the angulation or the tilting of the teeth is such that it is very difficult to make a proper denture or make a proper bridge. So that you would need a little bit of orthodontic treatment, an early spell of orthodontic treatment to position the teeth nicely so that you can make the bridge or make the denture better and more comfortably. So those are other things that we can do to aid other types of dental treatment. So all in all, orthodontic treatment is something that one should consider if one has things that one have crooked teeth. Not just for appearance, but so that we can keep a good set of teeth for us to enjoy our food, able to eat and chew properly. I think important thing for parents to think about is that what advice we can give is that the importance of baby teeth. Parents must not think that baby teeth are just temporary teeth. Baby teeth serve a purpose. They are there to hold the space for adult teeth. Of course, besides letting the baby eat and chew food, they are also there to hold the space for the adult teeth that will replace them. So it is important that parents take good care of baby teeth, bring them to the dentist for regular checkups. The baby teeth will be lost and shed according to the natural sequence of time. So when they are shed, the adult teeth will come and replace them. It is important they are there to hold the space. Otherwise, sometimes there is loss of space and makes crookedness of the teeth, crowding of the teeth more severe than what would happen. That's one advice I can give patients, parents. Besides of which, of course, if they feel that the child may need orthodontic treatment, please come and consult an orthodontist, and do not indulge in unwarranted, sometimes, extractions of teeth. So sometimes the orthodontist would want the teeth to be extracted as and when the treatment requires it, not much earlier. Because if you extract teeth too early for certain other purposes, then space is lost and the treatment is becomes very much more complicated. So do come in for regular dental checkup with a general dentist with a child, and also sometimes come in if you feel the need for an orthodontic consultation. It's not necessary that we would treat the patient then, but we will probably give advice as and when the patient may or may not need treatment, and what measures parents can take to ensure that their children have got nice developing teeth that will come out nicely. For adult patients, which I have a fair number of, they do seek treatment, and I find that adult patients usually are very well motivated. They know what they want, and we are able to treat adult patients usually successfully, and even into the later stages of life. So matured patients are able to be treated where formerly they never had orthodontic treatment. Do come in if you feel you need their help. teeth straightening, not just as I said for appearance, but because it helps you to enhance your ability to take good care of your teeth. And that is very important in the later stages of life, when we need all our teeth to help us eat and chew food properly for better oral hygiene, better nutrition, better health.